Good morning. It is. Thank you. It is such an honor and a privilege to be here with you at the 2009 National Hispanic Council on Aging. And as I look around the room, I see truly the face of America and the people that we serve. So I want to thank Dr. Torres and Dr. Cruz for inviting me, for the hospitality, and for all of you for being here and taking the time out of your day to talk about and listen as we talk about one of the most important issues facing our country, and that's the health of our people. And I think it's very important that when we think about health care reform, when we talk about all the statistics, what it's going to cost, who it involves, that we have to remember that it's about people. It's about all of us. So again, thank you all for being here and taking the time as we talk about healthcare in our country. That what we know about healthcare and that we believe is that healthcare is truly a human right. It is something that we all need to have access to and that we all need to be a part of, and it's definitely a part of our shared responsibility. I'm thankful to be from New Mexico. New Mexico is a beautiful state, rich in our history, our culture, and our diversity. But with this richness, we also have many continued challenges and opportunities. Although New Mexico is a very large state geographically, we only have about 2 million people that live largely in rural and frontier settings, both which, as I said, pose unique challenges for access and for quality health care. Many years ago, New Mexico made a commitment to focus our publicly funded and Medicaid programs toward home and community-based providers, as well as supporting the philosophy of aging in place, something that we've talked about this morning, that we should be able to stay at home and receive the health care that we need. When our department became a cabinet-level agency, we developed our mission and our vision that not only values the independence and dignity of adults and persons living with disabilities and their families, but that works hard to develop programs that support these missions. Because of this commitment, New Mexico does lead. We lead the nation in our percentage of Medicaid long-term funds that go toward home and community-based services, which again is keeping people at home in our state. New Mexico partners with our state agencies of Department of Health and Human Services Department for the delivery of our Medicaid long-term care waiver programs. And we've continued to hear throughout the conversation yesterday and today that it truly is a partnership and it takes people working together. The program that we have in New Mexico, and if you were in the legislative session yesterday, you heard a little bit about it, is called COLTS, or Coordination of Long-Term Care Services. Through contracts, we have 2 managed care organizations in New Mexico. We have contracts with the Mera Group and Evercare. 39,000 eligible New Mexicans and people living with disabilities are provided person-centered care through required individual care coordination. So we're asking and making sure that each of our recipients or our participants have their own individual service care coordinator. This system of service delivery is designed to provide individualized attention and personal care as well as maximize resources. The goal of the program is to bring people together to look at what your needs are, but then also to identify all types of services that are available to meet your needs to keep you at home. It is a program designed to address fragmented mix of institutional, state plan, and home and community-based services. COLTS covers primary, acute, and long-term care services in one coordinated and integrated program that incorporates Medicare and Medicaid services into an approach that is intended to be seamless for participants and our members. So the program is definitely a large undertaking for the state of New Mexico, and we're working very hard with our managed care organizations to make it work. To further the goal of supporting aging in place and with a focus on health and wellness, New Mexico Aging and Long-Term Services Department also coordinates and provides access to health care through services and information through our Aging and Disabilities Resource Center. Many of our states, perhaps most of all our states, have Aging and Disability Resource Centers where we have trained care coordinators that provide information to people who need this information. So you can call an 800 number in New Mexico and in most states, and they will help you determine what you might be eligible for in the needs of Medicare benefits, prescription drug assistance, locations of healthcare providers, Medicaid programs and eligibility, adult protective services, transportation, housing, food, and food stamp supports, and so much more. So Aging and Disability Resource Center are truly a key to access healthcare in our states. Support to our homebound individuals is also provided through many programs. And one program I wanted to highlight today, and the reason I do this is because I want to talk a little bit that it really is an integrated program when we talk about healthcare and working people and bringing people together. Our senior companions provide the human connection that truly helps to fight behavioral health issues such as depression, anxiety, substance abuse, and hopelessness, all of which must be considered as we discuss healthcare, wellness, dignity, and hope. I recall my first visit with a senior and his compañero, and I was sitting in the living room. We were talking in English, half Spanish, and it occurred to me that, this individual, the senior companion, was truly providing healthcare. He was listening to his friend, listening to his new companion, and he was bringing to his brother life. And that truly is, when we think about healthcare, it's not just about what providers and doctors and insurance, it's about human connection. And our senior companions throughout the country provide that. Healthy aging and healthcare must also support physical fitness and spiritual health. We heard Assistant Secretary Greenlee talking about our spiritual health and faith. And all of that comes definitely from a community, people bringing together, and a healthy body and being physically fit. And so we also support our Senior Olympic programs in the state. And I think that sometimes we don't think about Senior Olympics being a part of healthcare reform, but it so much is, because it's about a healthy mind, a healthy body, and a healthy spirit, and bringing people together. And although we provide many other and coordinate other healthcare services through our department, I wanted to highlight just two other programs real quickly. We heard about Assistant Secretary Greenlee talking about long-term care ombudsman. And I want to tell you that our long-term care ombudsman, individuals who go into nursing homes and assisted living centers and facilities, they have a motto, and they adhere to that motto, and I'm sure you've heard this before. To the world, you may be one person, but to one person, you may be the world. And our ombudsmen and the people that go into our nursing homes, our assisted living, truly are the world to one person. They're providing companionship and giving them a voice and treating them with dignity. Our ombudsman can make the difference of life or death many times in those facilities. And as Congress considers the future of the Elder Justice Act, which is another piece of legislation that we need to talk to our congressmen about, in all of our United States and all of the states here in our territories, we also have a darker side of adult abuse, neglect, and exploitation. And in New Mexico, we do operate our adult protective services. And as we discuss healthcare in our country and the many facets of what that should be, we talk about what it should be, how should we pay for it, and how we must take responsibility as a people, we need to remember that we must protect our frail and elderly and give voice to those living with disabilities, and that health care must be comprehensive and inclusive. So I again encourage you all to talk about with your senators the Elder Abuse Act. And before I conclude, just want to make a note that when as a country and states and communities, healthcare providers and insurance comes together to discuss healthcare, we need to remember what we're really talking about is people. And we're really talking about the services that make an impact in our states and our communities. So again, thank you all for letting me join you at the National Hispanic Conference on Aging. And it is indeed an honor to be here and to be sharing this time with you. Thank you.
Thank you so much.